Hi, so we're going to talk about GBS today, or Group B strep. When I would be sitting down with a client, first of all, I would ask what they know about it, ask, kind of what questions they have, just kind of get a feel for where they're at. Have they already done a bunch of research? Have they never heard about it before? And then I would just generally start talking about GBS, kind of what it is. So in general, GBS is just a bacteria that lives in the intestines of all healthy, normal people. And about 25% of pregnant people also have this bacteria in their vagina. And it can kind of come and go. You may have it, and it may you may not have it in a few weeks, or vice versa. You may not have it right now, but next month you could have it. So why do we care about this in pregnancy? GBS is not dangerous to the pregnant person. However, as babies come down through the birth canal, through the vagina, they come in contact with this GBS bacteria. And a small percentage of those babies that come in contact with it, they can become sick. So some of the factors that would increase babies' risk are those babies that are born before 37 weeks. If mom has an infection in labor, a fever specifically, or if the waters broke 18 hours or more before baby was born, that all puts baby at higher risk. And of those babies that get this disease, about 25% of those will have kind of major lifelong complications: hearing loss, vision loss, learning difficulties, and ultimately 5% of those babies get very sick and will die. So how do we test for this? It's a simple test. It's like a Q-tip swab. I can send you to the bathroom with it. You can do it yourself. It goes about that far into the vagina, kind of swirl around, and you come out and drag along the perineum. Basically, we're trying to get just a sample of the bacteria that's in the lower 1/3 of the vagina, and it's just right on the outside. Then we send it off to the lab. They culture it. We have results in about 5 days. So then we wait. We get your results back. They will either be positive or negative that GBS bacteria was there. So now you decide if you want to treat it, if you want to do anything about it. So let's look at some of those numbers that could help you make that decision. So without treatment, for just in general, anybody that has not been tested for it, about 1 in 3,000 of those babies will get sick. If you test positive but have no additional risk factors, 1 in 770 of those babies will be sick. If you test positive and your water has been broken for more than 18 hours, 1 in 150 of those babies will be sick. And if you have the GBS and you have a fever in labor, 1 in 20 of those babies will get sick. And I have all of these numbers here. I'm going to give this to you and send it home and give you the opportunity to look over it. So if you decide to treat, if you test positive and have no additional risk factors and you get 2 doses of antibiotics in labor, there's a 1 in 100,000 babies will get sick. If you get less than 2 doses of antibiotics in labor, then there's a 1 in 80,000 risk for your baby. And if you test positive and have a fever in labor, that's 1 in 4,000. So, and again, we're remembering that 1 in 4,000, or 1 in whatever number we're talking about, that one baby has a 25% chance of hearing loss, vision loss, things like that, and 5% of those babies will die from this. So, what do we recommend? Basically, the CDC recommends that you get antibiotics in labor. What that means: your water breaks, labor starts, we come to your house, we start an IV in your hand or in your arm, and we give you a dose of antibiotics. We take the IV, we leave the catheter in your arm and just unhook you so you can go walk, whatever you want to do in labor. And that's it. There's no really other great treatments that have been CDC approved. So you have the opportunity to decide to test or not test, and then decide what you want to do with those results. And you can choose antibiotics or not. Do you have any questions? That was really fast in 5 minutes. So basically, I would be sending the client home with this information. I would be asking them if they had any more questions. I have some great resources on here for them to look up some more things if they need to or want to. And I will just help them make the best decision possible, and also ensure that they know that they can change their mind at any time as well, whether it's changing their mind about being screened or not screened, or treating or not treating. So, blah, blah. Thank you.